and thank you very much for joining us here today. First, I'd like to thank all of our very valuable healthcare workers that are out on the front lines and working behind the scenes to keep our healthcare system working at top notch. These healthcare workers continue to do a great job, and not only with the COVID patients, but all the patients that we are facing here in Saskatchewan. As we navigate through through Omicron wave, it has become clear that Saskatchewan's COVID-19 response must transition to consider the wide adoption of take-home rapid tests that have been proven effective against transmission. The Omicron variant continues to spread and resulting in high case numbers here in Saskatchewan, across Canada, and around the world. However, a significantly lower number of cases that are resulting in serious outcome compared to previous waves. While Omicron can still be very serious for some, particularly if you're not vaccinated, most cases are less severe symptoms or none at all. This is thanks to large part of our high vaccination and booster rates. As we learn to live with COVID, we learn to be prepared to transition our public health measures and responses. That's why, on the recommendation of our Chief Medical Health Officer and his team, we are announcing several changes to the self-isolation and close contact requirements. Effective this Friday, January 28th, all residents who receive a positive COVID-19 test will be required to self-isolate for 5 days, regardless of vaccination status. Close contacts of COVID-19 cases will no longer be required to self-isolate, regardless of vaccination status. Close contacts should, however, continue to self-monitor for symptoms and use our publicly available rapid tests. Parents and caregivers are no longer required to notify schools about positive test results for the purpose of close contact notification. However, those who do test positive are still required to self-isolate. If you are currently self-isolating for 10 days because you are unvaccinated confirmed case or a close contact to a case, you may be able to amend your self-isolation period as of noon, January 28th, if you are asymptomatic. If you are symptomatic, you must continue to self-isolate until your symptoms are resolved. Masking and proof of vaccination and proof of negative test requirements remain in place. Individuals should continue to do a personal risk assessment and continue to take the precautions that they feel necessary during their day-to-day activities. Saskatchewan continues to have a robust supply of rapid tests and offers them at more than 600 locations across our province. You should continue to use these and screen as frequently as you feel necessary. I would like to thank all the Saskatchewan residents for continuing to follow the current public health guidelines. Because of your efforts, we are able to announce these changes today. With that, I will turn things over to Dr. Shahab if he's available.
Thank you, Minister. Apologies for the delay, everyone. We were just having a little bit of trouble getting Dr. Shahab connected. So if you give us a few moments, we will try and get that connection made.
Hi, can you hear me?
Yes, we can, Doctor.
Thanks. So I was dialed in as well, so I'll just disconnect that to prevent an echo.
Perfect, thanks. And go ahead whenever you're ready.
So just wanted to confirm there's no echo. I'm dialed out from the audio. Is that okay?
You sound good.
Okay, thank you. So what I'll do is I'll walk through the slide deck everyone would have received, and that will be posted on for reference as well. The first slide is titled Living with COVID, as Mr. Mentioned, and it really is an update to case management. And as we discussed yesterday, this has been an evolutionary process, starting with reduced isolation periods a few weeks ago, and now removing in the public health order to the requirement to isolate as a close household contact. And this really, moving to slide 2, aligns with how we respond to communicable diseases, including influenza, pertussis, other communicable diseases, that obviously when there's a pandemic, when there's a new disease, as COVID was, we obviously manage it based on the issues at that time, which have evolved over the last 2 years through, original strain, alpha strain, delta strain, and now the Omicron strain. And really, the purpose of public health remains, timely detection of communicable diseases such as influenza, and we see different strains every year to provide an early warning system for control measures as appropriate to minimize transmission. And that is very different for measles compared to pertussis, compared to influenza, and now compared to previous strains of COVID and the Omicron strain. And obviously, we continue to track the trends in Saskatchewan and report on that daily and in more detail as our monthly breakthrough reports. And we use that information, obviously, to inform the public as today, and also to work with the medical community in terms of what our information suggests about better management, both in the outpatient setting. So yesterday's announcement spoke to not only the ongoing role and benefit of vaccines, but the role of antivirals as well as monoclonals for persons who are at high risk and qualify for those treatments, and the role of testing both PCR and rapid antigen as a route along with the select criteria for pre-hospital treatment. Coming to slide number 3, COVID-19 obviously will continue to be monitored and managed similar to other respiratory illnesses like influenza that are widespread. And we all have seen how Omicron is very different from previous strains. Rather than a disease that was managed through case contact notification, we already, when we had high case numbers in Delta, shifted to contacts being notified by the case. And with Omicron, that will continue to be the case, that close household contacts will be notified by the case. But the management really at an individual and household level would be self-management. And that really would focus on cases isolating for up to 5 days or till symptom-free, and close household contacts and other contacts continue to monitor them in an ongoing fashion. And so, again, focusing on moving to slide 4, what this really means now is that, like many of us have been doing, if we become symptomatic, we should isolate till we're symptom-free. If we have access to a rapid test, we should do that if we are concerned, and isolate even if we are symptom-free if the rapid test is positive. If you're symptomatic, we can monitor ourselves for a day or two and stay at home till symptom-free. If we have access to rapid antigen test, we can use that, and if positive, isolate till 5 days of symptom-free. And if our symptoms are worsening, and especially if we are older, have other comorbidities, or may qualify for treatment, that's a good time to get a PCR test. And that's when, again, till such time that the PCR test is reported, we continue to isolate as cases. So the situation for cases remains as isolation for 5 days or for till 24 hours till symptom-free, but close contacts are no longer required to isolate. In the past, close contacts who were fully vaccinated did not need to isolate, but unvaccinated close contacts did for up to 10 days. But again, that is no longer thought useful, because in many cases, close household contacts, some do develop symptoms at the same time or within a day or two and need to isolate as cases. Not all household contacts become symptomatic. And of course, other close contacts don't become symptomatic and were not required to isolate in any case, irrespective of vaccination status. So this kind of simplifies the process in terms of obviously minimizing the risk of transmission by isolating if you're symptomatic or test positive, being always diligent, and especially if you're a close contact or a household contact as you're out and about, but reducing the number of people who have to isolate, when many in case will either not develop COVID even as a household member, and many who do will do so within 1 or 2 days. And so using our symptom check, self-check, and using home antigen testing, we will, in any case, as cases, be isolating for that 5-day period. Moving to slide number 5. So again, we all know all of this, but I just thought it'd be good to just go over again what the guidance remains, both in the order and as recommendations for cases. So if asymptomatic and test positive, self-isolate for 5 days. If you're symptomatic and test positive, self-isolate for 5 days from the date of testing or 24 hours after fever has resolved, without the aid of fever-reducing medications, and all other symptoms have been improving for at least 48 hours, whichever is later. Continue to monitor for 10 days after test results and take all available precautions, masks, limit contact with at-risk individuals, and you will be required to abide by the proof of vaccination negative testing requirements at workplaces, venues. And I think this is important because we've had lots of questions about why did we go from 10 days to 5 days. And what we have seen with Omicron, similar to other jurisdictions, is that it does, when you get exposed, instead of becoming symptomatic at 3 to 4 days, many people get symptomatic at 2 to 3 days. So the time between exposure and symptoms is compressed. And while rarely people can still be infectious on days 7 and 8, most people who are asymptomatic or have mild symptoms, their risk of infectiousness is reduced by day 6, and they can safely go out and about as long as they wear a mask and take all the other precautions. But of course, if you're asymptomatic, tested negative on day 1, and then you started developing symptoms on day 4, and you still have a fever on day 5 or 6, obviously those are situations where you should remain at home till you are 48 hours symptom free, and that may mean that you will end up isolating for 6, 7, 8 days. But for most people, that 5-day is sufficient to become non-infectious and continue to restart work or school in a safe manner as cases. So nothing has changed from cases since when the change was made a few weeks ago. But for close contacts, and this is slide number 6, obviously we should all be self-monitoring ourselves on an ongoing fashion, and that's been true throughout the 2 years of the pandemic, but that's especially true with Omicron because we can no longer rely on cases notifying us, because in many cases we may get exposed to someone who themselves may be asymptomatic and may not know their case. But if we are a close contact, especially a household contact, we should especially self-monitor for 10 days. And that includes self-test using an antigen test immediately and on day 3 and 5. And that is in a household setting. That's because in many cases, if one person becomes symptomatic, the other household members may not be the ones who are exposed. They may have actually brought it in and may already be positive, but may not know it. So it's a good idea for all household members to test themselves immediately and then again on day 3 and 5. And then if you become symptomatic, self-isolate for 5 days as a case, and continue to take all available precautions if you're outside the household. And especially, around people who are at high risk. For example, people who are elderly, are immune compromised, both in the household setting and outside the household. But of course, all close contacts can continue to go to work and school while self-monitoring. Previously, that was true for everyone who was vaccinated. Now that applies to everyone, irrespective of vaccination status. But having said that, I think we do need to accept that, while being vaccinated does not completely take away the risk of acquiring mild Omicron infection, and even people who have received the booster dose in many cases do get Omicron, which in most cases is mild and self-limited. We do have to acknowledge that having 2 doses of vaccine, anyone 5 years and older, and then getting a booster dose 3 months or more after your second dose does reduce your risk of severe outcomes and hospitalizations significantly, but also does reduce, especially for up to 10 weeks after your second dose or booster dose, your risk of acquiring and transmitting Omicron. So again, this still doesn't mean that people who remain unvaccinated shouldn't think of getting the first and second dose and the booster dose, because this has a significant incremental benefit in reducing transmission, but also reducing the burden on your own health. Obviously, no one wants to end up in hospital, but also on the health system in terms of reducing the risk of hospitalization and severe outcomes. Slide 7. So this really, we're moving gradually to living with COVID in terms of a self-management approach to COVID-19. And if you recall, 2009 summer and fall, the H1N1 pandemic, actually what we are doing now with Omicron is very similar to how we approached the entire pandemic in 2009. But with some differences. The H1N1, there was just one dose of vaccine required. With COVID, there's 2 doses plus a booster. With H1N1, we did not have widespread access to home testing. With COVID, we do have, and I think we are uniquely positioned in Canada to have had wide, easy access to home testing that we should fully utilize as described. But beyond that, I think this supports a self-management approach, and this will have to be used to balance any risk of community transmission, which will continue not just in the household setting, but in the work and school setting, but at the same time reduce the burden of self-isolation for not just cases which happen with the reduction in isolation period to 5 days, but also for contacts, because ultimately, so many of us on any given time are notified as a contact that it's really not feasible for us to continue to isolate every time we are a close contact. But having said that, some settings where people at high risk are present, like long-term care, healthcare settings with people at high risk, like cancer care, they may have additional protocols and precautions, which include a high level of PPE, personal protective equipment, more frequent testing. If you're unvaccinated, even during outbreaks, testing of everyone irrespective of vaccine status. So different conditions may still apply to high-risk settings. And finally, coming to the last slide, this is all part of a gradual transition. Obviously, this has been, we have been gradually modifying the public health order and recommendations as we peak and now hopefully start coming down the Omicron wave. And to reduce the risk to others. And we all need to understand also that we all need to play a role in this to reduce as much as we can the transmission of Omicron, while understanding that it's so transmissible that many of us who were able to dodge COVID prior will get exposed. And for most people, especially those who are fully vaccinated and boosted, it is proving to be a mild self-limited illness for 5 to 7 days. Even people who are unvaccinated, for people who are young, otherwise healthy, for most people, it continues to be a self-limited illness, while recognizing that, being vaccinated, getting your booster dose does reduce our individual risk of hospitalization, and being especially cautious in people who remain at risk, irrespective of their vaccination status, that includes people who are elderly or immune compromised, will continue to be, even after the Omicron wave ends, something that we do all the time with other infectious diseases and should continue to do with Omicron as long as there's a global pandemic. So with that, I'll stop and back to the chair. Thank you.
Thanks, Dr. Shahab. We'll now move to questions. If you could just use the raise hand feature at the top of the page toward the right, we'll go through the list and we will start with Yasmin with CBC.
Hey, just confirming you can hear me?
Yep, go ahead.
Thanks. What is the government's overall goal here when it comes to COVID policy now? Is it about reducing hospitalizations, which are expected to grow even more, or is it just to live with COVID? What is the goal exactly, and how will the government know if it's achieved it?
So my apologies. I actually had to switch on my audio after I finished speaking, so I may have missed the early part of the question. If I was expected to answer that, apologies.
Yeah, it was actually more. Yeah, sorry, go ahead.
Go ahead. Would you like me to answer that one, Yasmin?
Yes, please.
I guess our policy as government is continually evolving with COVID-19 and with throughout the Delta wave and now through the Omicron wave, is we have to continually adapt to what we're seeing in front of us, what the real data is explaining to us and showing us. What we're seeing right now is as Dr. Shahab has clearly laid out, that Omicron is completely different than Delta, and we have to adapt our policies and our self-isolation right now to be able to make sure that we're dealing with this wave as the best we possibly can. Now, reducing it from 10 down to 5 does not mean that COVID has gone away. It has not gone away, and I want to be very clear about that. But how we are dealing with it is continuously evolving.
What about proof of vaccination requirements? Will these also go soon, as the Premier hinted yesterday?
I think as a government, like I just said, we're continually looking. It's in place now until February, and we will have discussions with Dr. Shahab to see where that is. Right now, it's in place till the end of February, and we're going to continue that with the masking, the verification, and the negative tests, those 3 pieces. Those are currently in place and will remain in place. But as I've said before, this is continually evolving. What we're seeing this week is different than what we saw 3 weeks ago. 3 weeks from now, it might be very different. But we're very optimistic that we're in a very, very good spot as far as addressing what Delta is bringing to Saskatchewan.
And next we'll go to Lynn with the Leader Post.
Okay, I think I got myself off mute here. Minister Merriman, does the number of people who get COVID-19 matter to you?
Oh, absolutely. I mean, we're looking at that. It's very important that we look at all of the numbers. But what we're seeing is, even though the large volume of numbers of people contracting COVID-19, that is not transitioning into larger numbers than we saw with the Delta wave in our hospital. And we have to remember what we were backing up when originally COVID was presented to us, and we had to deal with it, was to protect our healthcare system and protect against severe outcomes. And we're still continuing to do that.
Do you have a follow-up, Lynn?
Yeah. Why is the SHA talking about moving patients because of acute care probably being overwhelmed in the next little bit, while the government reduces public health measures? Isn't that terribly mixed messaging?
We've been moving people around the province. A lot of people from rural and the north move into our larger centers. This is something that's ongoing. Now, when our larger centers are at capacity, we have to look at our overall healthcare capacity to make sure that we are maximizing that. We can't have hospitals in Saskatoon and Regina at a state where they're at or above capacity when we have capacity in other parts of the province. So this is something that we've done before. We've called it load leveling to make sure that we are able to provide the best patient care for each individuals. So, and again, this is something that's just started. We're hoping that we don't have to do this for very long or very often. But again, we will do this in consultation with patients and their families to make sure that everybody is aware of what's going on and why we're doing this and how long we're doing it.
Now we'll go to Zach with the Star Phoenix.
Good morning, Minister. You read my mind. I want to ask you about load leveling. We understand that the goal is to repatriate 30% of rural and northern patients in Saskatoon and Regina, and to decant, I think was the word used, 40% of ALC and long-term care patients to rural and northern locations. I understand by Sunday. EMS services are telling me this is going to be incredibly difficult. Some doctors are expressing some concerns to me that services that are in Regina and Saskatoon aren't in those rural areas. And there seems to be confusion about where specifically patients might go. I'm wondering if you can explain how this plan is going to roll out and how you respond to concerns that it's not feasible at this time.
Well, what I would say, Zach, is that we are continuing to make sure that we're utilizing our healthcare system in the best capacity. If we have capacity in other areas of province, we have to be able to utilize that. Now, as far as the timeline on that you've outlined, we're going to continue to work. We're not going to force this on rural Saskatchewan. We are going to work with the local centers to be able to make sure that they are ready for this. This isn't going to be thrusted upon them. We're going to work with them. We're going to work with our EMS providers to be able to make sure that this can be done in a safe and timely manner. But we want to make sure, again, that we're using our full healthcare capacity within our province. The provincial healthcare system is for everybody in the province, and we need to make sure that we're utilizing that. We can't have hospitals that aren't at capacity while we have other hospitals that are at or above capacity. We want to be able to make sure that we're providing the best patient care.
Before I ask my follow-up, are you able to say, just as part of my question, where these patients are going specifically?
The SHA will make that determination on to where the individual patients will be going. And again, this will be done in consultation with the families and the patients on the time frame, the location, and the logistics of that if and when it occurs for any specific individual.
Thank you. For my follow-up.
And sorry, Zach, before you ask, can we just check to see if Dr. Shahab has anything to add to that one?
Oh, absolutely.
Sorry, which specific portion of the question?
Hi, Dr.
Just in regard to, I'll let you repeat your question, Zach.
Oh, sure. Yeah, Dr. Shahab, I was just asking the minister about the plan to move many patients from Saskatchewan, Regina to rural and northern locations. My question was around whether this is going to be feasible and safe at this time, given some concerns we're hearing from doctors and EMS providers. Happy to hear anything you might add.
Yeah, so again, I don't want to speak on behalf of the SHA and EMS staff, but obviously we have seen not just during Omicron, but as a part of routine operations of the health system, that patients, both infectious and non-infectious, from all communicable diseases, there are protocols to safely move patients from one, to a high level of care, and when the high level of care is not required, safely to an appropriate level of care. And we also know, as we've discussed in the past, that with Omicron, a fundamental difference is that while the number of cases is higher, the proportion of cases, thankfully, requiring hospital care is lower. But because the number of cases is higher, that still is a significant number. But even within that, the proportion who require ICU care is lower. And even within acute care, there's a whole gradation of people who may screen positive for COVID, but may be in for a procedure that can be safely done at an appropriate facility. There may be individuals who may require some acute care because of COVID, but also because of other comorbidities, because as we've seen throughout COVID, but especially with Omicron, people who are elderly, frail, who are more likely to require hospitalization for their underlying health conditions, are also more likely to be hospitalized with their underlying health conditions getting unstable because of Omicron. And again, that level of care is routinely provided throughout the health system at local hospitals, regional hospitals, tertiary hospitals, and the transfer back and forth happens routinely. And obviously, that does not take away the challenge that increase in hospitalizations that we will continue to see going up, because many provinces where case numbers have peaked and have come down are still continuing to see an increase in hospitalization. And there's two reasons for that. One is the 2 to 3 week lag. And the other is, while we have kept up with our PCR testing, many provinces even 2 or 3 weeks ago had said that their PCR testing was not keeping pace. So while their case numbers came down, either due to actual reduce in transmission or due to an artifact because of testing capacity, their hospitalizations have continued to go up. And we will see that to lesser extent because of testing capacity, but to a significant extent because of the lag period. And also, as I mentioned yesterday, urban centers, young population first saw Omicron transmission and we have peaked. But as we come down overall, we will see some increase in older, rural, northern. And then if those populations are not, they have a lower booster dose uptake as well, that will continue to generate some pressure on hospitalizations that again has to be managed in terms of what's the right place for the right level of care for people with Omicron and comorbidities, with another reason for urgent or emergent care or elective care where people may screen positive for COVID, and also for the bulk of non-COVID care. So I think it's a complex system made more complex with COVID. And I think that's where the health system will need to continue to manage.
Thank you. And as a follow-up to Minister Merriman as well, I'm hearing some concerns from occupational safety companies about the private rapid antigen testing system, the alternative essentially to showing proof of vaccination. Some companies are telling me that they're not happy with the safety standards that exist, that they feel that some operators who have signed up for that program are maybe not acting in good faith and have very few qualifications to actually, be providing this testing. And I also understand that there was a requirement introduced that those testers had to themselves at least be vaccinated, and that this was walked back just a few weeks later. I wonder if you can tell me what government is doing to address these concerns about this, about basically the security and the accuracy of that testing system.
Well, what I would say is on the private testing, that's again, the preference is for people to go out and get vaccinated, but understand that people do want to access that negative test. There are private providers out there that are licensed and approved through the process of the ministry and the SHA to be able to provide this. We do check in with them to make sure that they are providing the proper testing and the requirements for them to be able to do that. So again, we're going to continue to do that. We've just extended out the licensing for I believe another month, but I will get that information to you, Zach. But again, this is part of the process, is not just our rapid antigen test, but our PCR tests and our vaccination to make sure that we're providing the best quality healthcare. As far as that, we're going to continue to work with the private providers to make sure that they are providing the service that we expect as government and that the people of Saskatchewan expect.
And next we'll go to Omar. Omar, are you able to unmute yourself? It looks like Omar's mic is not working. We will circle back to see if we have time for him at the end. Next, we'll go to Mickey with the Canadian Press.
Thank you. This question's for Dr. Shahab. Does science tell us that Omicron is starting to look like other common respiratory illnesses? And is it rational to treat it like something completely different at this point?
So I think we need to, while we are moving to a different phase, I've called it the Omicron era, we need to be cautious that each infectious disease is unique and each infectious disease evolves. And, there's a reference to influenza. Some influenza years, the strain is well matched with the vaccine, and we see a high vaccine efficacy, which for influenza, by the way, is 60%. If influenza can prevent 60% of, if the vaccine can prevent 60% of illnesses, that's a well-matched vaccine. But we know that even on those well-matched years, we give a high-dose vaccine to seniors, long-term care, and we know that residents of long-term care, even with the high-dose vaccine, have a reduced response to influenza. But then there's antivirals and other treatment modalities for people at high risk for influenza. Obviously, everyone doesn't take antivirals for influenza. But people at high risk are able to take antivirals. So using the same analogy, the evolution of COVID has evolved where, we now have booster doses available. The vaccine effectiveness, especially after a booster dose, is extremely high to prevent hospitalization. But as we know through our breakthrough analysis, that people at high risk, older, immune suppressed, are still at high risk of being hospitalized. And that's why, again, I want to emphasize that people who are immune suppressed, Saskatchewan was one of the earliest provinces not just to give booster doses to people at high risk, but also to give a third dose for people who are immune suppressed, and which after receiving the third dose in August, September, they are also eligible to receive a booster dose after 3 months. So again, the mitigating factor has been, through vaccinations. Yesterday, there's an announcement on access to antivirals for those at high risk, which includes people who are unvaccinated and at a certain age with risk factors. Also includes anyone 18 and older with significant immune suppression, irrespective of vaccination. But we also know that, and in February, when we release our January breakthrough data, we will also continue to see as other provinces in Canada who are ahead of us with the Omicron surge, and other countries like the UK have shown that it's moving more from a severe illness in the unvaccinated, which Omicron can still be at any age, to a more severe illness in people who are more likely to be unvaccinated, but even people who may have had 2 doses but on a booster, and really even people who may have had a booster, so breakthrough disease, and people who are older with underlying risk factors. So that's now more similar to how influenza behaves when there's a poor vaccine match. And we know that while the vaccine is still very effective for most people in preventing hospitalizations, there's some loss of efficacy due to the Omicron stage, Omicron variant, which shows some vaccine escape. And that's why boostering is important, and also where appropriate access to therapeutics.
And do you have a follow-up, Mickey?
I do, thank you. This one's for the minister. We're several weeks behind other countries that are now starting to lift their COVID-19 restrictions. At what point does this government say the cost of the pandemic restrictions are outweighing the benefits?
Thanks, Mickey, for the question. And as I identified before, we're continuously looking at what Omicron is bringing to Saskatchewan. We're looking at other jurisdictions. We're looking at other provinces to see that what it is that is working, what is not working. Some of the things that we have seen that are working are obviously our rapid test system, which is leading the country, I would have to say. Also our booster shots. These are the things that we're looking at. As far as what is happening after the end of February, as far as our public health restrictions, we'll have to discuss it later on. I can't give you that information right now. We'll have to look at that in a few weeks as we're seeing that the Omicron is continually evolving. We're going to continue to evolve as government to make sure that any public health restrictions or any guidelines that the government is doing is meeting the needs of what Omicron is putting in front of us.
And next we'll go to Connor with Global.
Question probably for the minister. Understand that we're looking to moving into this phase, this Omicron era, this phase of living with COVID. So I guess I wonder what your message is to those outliers. Omicron might be less severe, but it's likely that there are still immunocompromised or just unlucky.
Sorry, Connor, I think you cut off, but I think I got the gist of your question. I guess I would have to tell everybody is, use the rapid test, go out and get vaccinated, get your booster shot, do your own personal risk assessment. That is extremely important. Dr. Shahab and I have been saying that for months now. Use your own personal risk assessment. If there's something that you're not feeling comfortable with or a situation, then you need to be able to assess whether you need to participate in that or not. We would encourage people, now that the weather seems to be a little bit better, to be able to get out, enjoy this weather while we have a little bit of a break. But again, do your own personal risk assessment whether you should be participating in an event or not. That's up to each individual person.
And you have a follow-up question, Connor?
This is Mickey with the Canadian Press. He said his internet dropped, so maybe if you could circle back to him later, he would appreciate it.
Sure, we can do that. And next we'll go to Nicole with CTV.
Hello. So my question is about the Paxlovid pills that have just become available in Saskatchewan as of yesterday. My question is about, what have the requests been like? I know we only have about 900 courses of it, so not a whole lot, but what has the demand been like for that so far? Is there still supply left, or has that already kind of been tapped out at this point?
I'll maybe start with that, and then maybe Dr. Shahab, as it's just in its infancy right now of getting that out and moving it across the province. Again, the process is you have to go through 811, no different than our monoclonals that we were dealing with a while ago, and that we still have actually. But it's a little preliminary right now to get some numbers. But we're hopeful that this is, again, another tool that we have in our toolbox to be able to deal with COVID. Dr. Shahab, did you have any other comments?
Yes, thank you, Minister. As Dr. Takaya mentioned yesterday, she spoke to monoclonals that, again, I think we need to recognize our strengths that in addition to being a leader in giving booster doses and access to home testing, Saskatchewan did lead Canada in broad access to monoclonals. And as Dr. Takaya said, the utilization of monoclonals has picked up. I think it was 96, but then even yesterday it crossed 100. So that's good news. Monoclonals are available at a wide variety of locations throughout Saskatchewan. And then, as Dr. Takaya said, and as Minister said, the antivirals are available in even a greater number of locations because the monoclonals need an infusion. The antiviral, which is a 5-day course, can be dispensed by many pharmacies throughout Saskatchewan. But I agree with the Minister that I think in a week or two, we'll be able to give utilization updates both for monoclonals, which continues, as well as antivirals. Thank you.
Thank you. I have a follow-up just kind of about, I guess, how much this will actually help people, because of course there are quite a few, requirements to even be eligible to use these Paxlovid pills. So I guess, how many people do you think this will actually be able to help? Just considering those requirements are so strict.
Well, I would say, we received 900 initially. We're hoping that there's good positive uptake. And again, every one of these tools that we have, whether it's vaccination, boosters, monoclonals, antibodies, all of these are out there to help prevent people coming into our healthcare system. So we're hoping that there's good uptake on this, but we'll have to see in a few weeks to see exactly what the uptake is, and if there's specific areas, specific geography, or specific demographics that have more uptake, then we'll focus our attention in on those specific areas.
Perfect. And I see Connor. Oh, sorry, we'll go to Dr. Shahab.
And I'd also like to add that as we were talking about the public health approach and how that evolves, even if you look at other vaccine preventable diseases, the mainstay of preventing a vaccine preventable disease is by getting vaccinated. And even for other diseases, while on occasion an immune globulin similar to a monoclonal or an antiviral, is given in specific situations where someone is unvaccinated and develops, measles or chicken pox, or an antibiotic is given if someone develops pertussis, that even though those antivirals in some cases are widely available, like antibiotics or some antivirals, and some immunoglobulins, for example, are limited availability, they can never ever take the place of vaccination. And the same principle applies and will apply even as the antiviral supply improves, that I think we still need to state very clearly that the best prevention is vaccination, including getting your booster dose. And I would urge people who not to use antivirals as a way to protect themselves instead of vaccination. And there's still tremendous benefit from getting fully vaccinated and getting a booster dose. Thank you.
Thank you.
Thanks, Dr. Shahab. And I see Connor has joined us. Connor, are you able to ask your follow-up question?
Yeah. Sorry, did the minister respond to the first question? I dropped out completely there.
Yes.
Yeah, I did respond. I think I got enough of it, Connor. Did you want to do your follow-up?
Yeah, sure. I guess not knowing what you said, I'll just throw this out there. I guess maybe for you or Dr. Shahab, how do you, I guess, sort of long-term, looking a year or two out from now, want people to view COVID-19? We already touched this a bit in the meeting, but is something like the flu, are we going to expect to want people to self-isolate for 5 days a year from now? Like how do you want them to carry forward the habits that they've built as this has been treated more seriously in the first 2 years of the pandemic?
I think I'd let Dr. Shahab touch on what's going to happen. I mean, it's hard to say in the long years of where exactly we're going to be with COVID. We're hoping, I think everybody across the country and around the world is optimistic that we can start to look at putting this behind us. and making sure that we are diligent. We are getting our vaccination, as Dr. Shahab just pointed out, our boosters, doing our own personal risk assessment, using our tests, using all the tools we have there. But I think everybody would breathe a sigh of relief if we could put COVID in behind us, and but not necessarily forget about it, but just live with COVID. Understand how to live with COVID in a proper and safe way. Dr. Shahab?
Yes, thank you. I would say that, obviously there's a short-term, plan at this point, over January and February. Then there's the midterm plan and the long-term plan. But as many countries like the UK are already messaging around their midterm plans that as they exit the Omicron surge, both in terms of reduced case numbers and reduced hospitalizations, and as they can confirm the high level of immunity in the population, both through primarily vaccination and booster doses, but also the additional immunity through exposure to COVID, especially Omicron, because most countries are saying, including the UK, that more people got exposed to Omicron in the last 8 weeks in the UK or 12 weeks in the UK than got exposed to their previous 3 waves, which were themselves significant. So I think using all those things in consideration, I think, as the minister said, most jurisdictions are optimistic of the spring and summer that, can they exit most, if not all, precautions. But I think, again, that'll depend on the data and evidence and risk as it evolves. But I think no one wants to predict the far future, long-term future, like the fall. I think we'll still have to understand how long does the protection with the booster dose last. What will be the circulating variants in the fall? I think it remains critical that Canada, along with all other countries, continue to support the rest of the world also being able to access vaccinations and achieving a high vaccination rate globally. And then based on that and the information on hand, I think the long-term future will continue to evolve. The response will continue to evolve in view of what's the situation with the variants, how effective are vaccines, is a booster needed, how much improved is the supply for antivirals for people at higher risk. Thank you.
And next we'll go to Sasha with CBC.
Oh, hi, good morning. Yeah, I just wanted to know, could you just confirm whether or not any patients have been transferred from Regina or Saskatoon to hospitals in rural regions, please?
I've been told that the process is starting, but again, it'll be done with consultation. The SHA would be rolling that out, but it will be in consultation with families, and we'll continue to work with families, but also the regional centers and the smaller centers to make sure that they do have the capacity and the staffing to be able to meet the needs of any patients that are coming into their facility.
All right, thank you. I don't have a follow-up. Thank you, though.
Thank you, Sasha. And next we'll go to Lisa with CJME.
Hi. I am just wondering where this move on isolation is coming from. Like, is there a study? Is there some kind of precedence that you're pulling from? Because I guess, for example, as far as I can tell, Health Canada is still recommending 14 days isolation for people who aren't vaccinated.
Yeah, so I think a couple of things. One, even on the federal website, we have to be very careful about archived content and current content. And thank you for this flag, because none of these changes at a provincial level impact the Federal Quarantine Act. So I think, and when someone asks me a question about federal guidance for people coming to Canada, I always go to the website for the most current information. But what my understanding is that at present, fully vaccinated persons entering Canada, which means 2 doses, no longer have to quarantine, but continue to self-monitor. But if a special exemption is allowed to allow an unvaccinated person to enter Canada, they have to quarantine for 10 days. That's my understanding. And that's a federal quarantine act. And that may apply because people may be traveling from parts of the world where there's higher transmission, or there may be unknown variants. And some people still are selected for testing after arrival. And that then also, informs the whole genome sequencing, not just in Canada, but globally, to continue to detect new variants should they emerge.
Sorry,
So,
maybe I should rephrase that then, and just ask where this is coming from. Like, is there a study or some kind of precedence you're pulling from for the move?
yeah. So in terms of why this change for cases and contacts, and that, sorry, there's a bit of echo coming. It most okay, I'll try again. In terms of the change in management of cases and contacts, I'll go to that. So while the outer limit came down from 14 days to 10 days for even the Delta strain, with Omicron, we have seen that for cases, while there can be low levels of transmission, day 6, 7, especially if you're symptomatic, most people don't transmit to a significant degree after day 5, so day 6, 7, and that is mitigated by proper mask use. But other considerations apply when you're working with high-risk persons like long-term care, or if you're symptomatic. So that's for cases. For contacts, while it's true that you are more likely to become a case if you're a close contact and unvaccinated, we have seen that although having 2 doses of vaccine, and the majority of people in Saskatchewan have had 2 doses, about a third have had boosters, 2/3 16 older. So that needs to go higher. But irrespective of vaccination, you can still become mildly ill and transmit, although the duration may be shorter and the intensity of transmission may be lower. So because that differential is not now complete between being vaccinated or unvaccinated as a close contact, that's why we have, based on that evidence, made that consistent, that isolation for cases is 5 days. There's no isolation for close contacts, including household contacts. But because we are able to easily self-test and access self-testing, we do recommend that all close household contacts test themselves at day 3 and 5, for example, and isolate if they are test positive. And again, I think this is also based on the science, but also the reality that while Omicron is more transmissible, while it's less severe, it also then, this change allows us to continue to support children to be in school learning, to support children to be engaged in other activities, extracurricular activities. It supports workplaces to have staff for the work to continue in a safe manner. So obviously, if you're symptomatic, you stay at home. But if you're asymptomatic as a close contact, you test yourself regularly, but you can continue to go to work. And finally, I'll say that all workplaces have or should have, a communicable disease plan as posted by Saskatchewan, WorkSafe Saskatchewan, and that then also incorporates what is unique to a particular workplace in terms of, further guidance for routine testing. So I think it is based on evolving science, but also on the feasibility of, having a lot of people who are isolating, which creates a lot of pressure on business continuity and the ability of students to be in class learning.
Follow up, Lisa?
Yes. Do you expect this move for people not having to isolate as close contacts and reducing the isolation time for positive tests? Do you expect this to increase cases in the province? And Minister, what do you say to healthcare workers who are maybe burned out, overworked, and they're going to hear this news?
Well, I first start by saying thank you. They've been working hard in the trenches to be able to deal with all of the people that are coming into our healthcare system, not just the COVID people, but the other people that are coming in with various other ailments. I thank them for that. I know they've done an amazing job, and I'm confident, as I said on Monday, I'm confident that they will be able to continue to do an amazing job to be able to provide the best quality of care for our healthcare workers. This is something that myself, the Premier, and all of my colleagues have been able to do on a daily basis. Every time I meet somebody within the healthcare system, I stop and I thank them I thank them for their service. So I continue to do that, and I know they will do. But we're also providing resources. We're also providing other resources. We're working with some of our international community that is here, the new Canadians that have applied. We're moving them forward, trying to get them done in a safe manner, as I talked about on Monday, to be able to get in, to be able to support them, not just ask them to do everything by themselves, but to provide those supports in behind them, to be able to provide the best quality care. So we're doing that. We're making sure that we're bringing in anybody, as we have before, the non-traditional immunizers, to be able to take some pressure off of our vaccination nurses that are in there. We're bringing in graduates. We're moving them up. We're upscaling people to be able to make sure that they can do different positions if we need them to move around. Cross-training has been going on for months now. We're utilizing all the tools that we have in our healthcare system, but at the end of the day, all I can say to them is thank you very much, and we're going to support you as much as we possibly can.
And next we'll go to Janelle with Global.
Hi, good afternoon. Yes, my question is for Minister Merriman. So last week I interviewed a rural mayor who says his town is one of the centers who are considered to be utilized for patient transfers, but he also expressed frustrations. So last week, Minister, you floated the idea in a press conference about transferring patients out of city hospitals into rural hospitals. I'm wondering what kind of consultation was done with rural hospitals and towns.
Well, that's the SHA coordinates all of that as far as getting people moving out. But this isn't something that is new within Saskatchewan. I've spoken to several mayors myself. Our Minister of Government Relations, Minister McMorris, is talking with the mayors and working with them on this. We understand that there are pressures in specific communities. We're very cognizant of that, and we're not going to add more pressure into those communities that are stretched. But we are looking at maximizing our healthcare system. If our healthcare system is only overall at 85%, we need to load level and put some people out into those specific areas for a short time until we can get our healthcare system in our major centers back to a normal place. So we'll continue to do that. Again, we're going to work with the communities. We're going to work with the healthcare providers. The SHA will coordinate all of this, and we will work with the families to make sure that everybody is understanding on why we are doing this and how long that we need to do this for.
And do you have a follow-up question, Janelle?
Yes, I do. So we're getting a lot of questions from our viewers why there's such a high number of, patients still landing in hospitals, and a lot of their ideas are the lack of vaccine efficacy. How can we explain that breakthrough rate to our viewers and readers about this?
I'll start. We'll be providing a breakthrough report at the end of January on what has occurred in as far as breakthrough cases. But I'll let Dr. Shahab speak specifically to the cases.
Yes, thank you, Minister. So I think it is important that we and again, there's been some significant studies published from the UK, from the US, and from BC and Ontario that continue to confirm that while Omicron transmission rates are high, and even though we have made some changes, we want to make sure that we don't see a rebound or increase in transmission. So we still need to stay the course, isolating when sick, self-monitoring ourselves as close contacts, frequent testing, and isolating if we become a case. We continue to see with Omicron that the hospitalizations are more in people who are older, who are immune compromised, and for every age group, hospitalizations more if you're unvaccinated. But if you are fully vaccinated and not boosted, the hospitalization risk is higher if you're 40 and older, for example. If you are fully vaccinated and boosted, while your risk is lower based on your age group 60 and older compared to unvaccinated, there is still some residual risk. So again, the caution for obviously everyone getting boosted, especially if they're 40 and older, and have comorbidities, but also for all of us to shield people who are 60 and older, 70 and older, immune compromised. So I think that is where the pressure is going to continue to come from, and our booster uptake is lower in northern remote areas. So I think that is an important message, that the vaccines right from the beginning were designed to prevent severe outcomes, which is hospitalization, death. They continue to do so, but the breakthrough data continues to reveal that with Delta, there were some breakthrough cases with 2 doses. That's why the booster program was launched in Saskatchewan as early as August, September. And then with Omicron, while it is more transmissible, it has lower virulence, but it still can result in a smaller proportion, but a significant number of people needing hospital care, mostly acute care. So again, I think it's a complicated message that while it may not prevent mild infection, even if you're fully vaccinated, boosted, it clearly prevents hospitalization. And I think that will continue to be an important message for your viewers based on questions that are coming in. Thank you.
Thank you so much.
And now we'll go to Austin Davis.
Thank you. Minister, government required that people providing private rapid antigen testing were required to be vaccinated, only to walk back the policy weeks later. Why?
Well, specifically because we wanted to make sure that everybody had access to negative tests if available. We also have people that are within our own system that are not fully vaccinated within our healthcare system that are providing negative tests on that. So we wanted to be consistent with people that are able to provide a negative test to be able to make sure that they can administer a vaccine in a safe way, or that they are fully vaccinated and boosted. So we want it to be consistent across the board.
Thank you.
A follow-up question, Austin?
Yes, sort of related. If this load leveling, Minister, is not being thrust on EMS services, why are the services telling us they can't handle the demand?
I haven't spoke to the EMS specifically. Again, that's SHA to be able to administer any of those moves that are going across the province. And again, we do move in the EMS, and I thank them for the ground service and the air service of moving people around a province continuously. We are always doing this. This is a challenge that we're seeing in our major centers, and we want to be able to make sure that we're doing that. As far as the EMS and the local hospitals, the smaller centers, my expectation is the SHA will work with all of them to make sure that this is as smooth as possible for any patients that do have to be relocated on a temporary basis.
Thank you.
Okay, thank you, everyone. Omar, I see you were able to type your question there. We got that. It was touched on, but we should be able to get you a response on that as well. With that, we will conclude today's availability. Thank you so much, everyone.
Thank you.